Hello, and welcome to my presentation on medical waste and its impact on public health. My name is Stacy Barden, and this is for NUR 520 under the direction of Dr. Kathy Murphy, professor at University of Hartford. The objectives of this presentation are to better understand what is medical waste. We'll look at where medical waste comes from. We'll look at the environmental impact of medical waste hazards on public health, the cost of managing medical waste, that includes disposal of medical waste. We'll look at ways to improve waste management and also ways to advocate for change. Medical waste, according to the Environmental Protection Agency, is defined as medical waste is a subset of waste generated at healthcare facilities such as hospitals, physician's office, dental practices, blood banks, and veterinary hospital clinics, as well as medical research facilities and laboratories. Generally, medical waste is healthcare waste that may be contaminated by blood, body fluids, or other potentially infectious materials, and is often referred to as regulated medical waste. There are several types of medical waste, but we're going to be focusing on the four according to the United States Environmental Protection Agency. The first is general, which is the bulk of non-hazardous waste, which equals about 85% of the waste in the U.S. There's infectious, which is contaminated with bodily fluids that could cause potential harm. Hazardous, which is dangerous items in sharps containers such as needles or surgical equipment. There's radioactive items used in radioactive treatments that can contain nuclear elements such as chemotherapy. Here we see a table that lists the different types of hazardous waste and how they're divided up by color coding, so that we know exactly what containers that they will go in. So we typically see a lot of these in very open medical areas. Often the red sharps containers are very common one we see a lot. It's for needles or broken glass, staples or razors. Then we also have the red biohazard bags, which usually line red containers, and that's for things like infectious waste, blood products, IV tubing. Another one that may not be as common for some people, it's the yellow container, which is for chemotherapy agents like gowns, gloves, tubing, ampules, needles, things like that. There is a black container for RCRA, which is an acronym that stands for the Resource Conservation and Recovery Act. It is a federal law that regulates the management of certain hazardous and non-hazardous wastes, as well as medical waste and even underground storage tanks. So this hazardous waste is the waste that appears on the lists under the United States Environmental Protection Agency that require certain ways of removing and eliminating it. So it will be things like hazardous bulk meds, P-listed drugs, bulk chemo, or even pathological waste. Then we have the blue container, which is pharmaceutical, which includes things like pills, injectables, antibiotics. And last, we have the radioactive, which is the white with the radioactive symbol on it. And this is for things like fluorine or iodine, cobalt, iridium, and things of that nature. Here we list a few waste statistics, medical waste, and some information. So hospitals alone produce approximately 5.9 million tons of waste each year just in the US, and that's according to the World Health Organization. Also, there's approximately 33 pounds of waste per patient bed per day. That's a lot of waste. And unfortunately, only 15% of that medical waste, which is hazardous waste, is actually regulated. 85% is general waste. Medical waste sometimes contains really harmful chemicals, or even the plastics contain PVC, which is very harmful to the environment when it's incinerated because it emits toxins. And unfortunately, the alternative, which is disposal into landfills, is also not a great alternative. And this has been an area of a lot of controversy over the years. There's a lot of improvements, but we have a lot of ways to go. Unfortunately, individual states now regulate medical waste, not the federal government. This has been since 1991 when the medical waste tracking system expired. It was a 3-year project that looked at how to manage sharps, because what was happening is all of these sharps, needles, and different infectious medical waste was washing up on the Northeast states' shorelines like Rhode Island, Connecticut, New Jersey, New York, Pennsylvania. So they created this tracking system that prompted new regulations of medical waste, but it shifted from the federal government to each of the states, and they all have different regulatory criteria. The government still has some level of regulation over the general waste disposal, and they look at different ways to protect the environment based on how these states are doing the waste removal. So some organizations that still monitor it is the Environmental Protection Agency, the CDC, and the Drug Enforcement Agency. Here we see some of the environmental impacts of medical waste. So if there's improper segregation of waste or treatment or improper disposal of medical waste, this is a global environmental health problem. And unfortunately, some ways to remove this waste is through incinerators, and these can be located in local communities that where they're emitting toxins into the environment. Medical waste also can lead to increased greenhouse gas emissions, smog formation, acid rain, air pollution, stratospheric ozone depletion, cardiogenic and non-carcinogenic toxins. Also, improper disposal can contaminate drinking water or landfills, which creates runoff into groundwater, and that poses a huge threat to our environment, not only humans, but also animals. Improper needle disposal can lead to transmission, or even other sharps can lead to transmission of infectious diseases such as HIV, hepatitis B, or hepatitis C. Improper handling of the waste product and management of the product, as well as disposal, can put these workers at risk for major health hazards if they're exposed. So this can be anywhere from the actual healthcare workers who are doing it all the way to the individuals who are disposing of the waste. So anywhere in between, even those who are transporting. COVID-19 unfortunately has posed a new threat on our environment, with an astounding amount of harmful articles now washing up on the shores of different countries. This includes masks, gloves, and other plastics. This is because now we're going into this time where we need to use single-use items to prevent transmission of the disease, but what it's doing is increasing this huge amount of single-use products, increasing the waste exponentially. Individuals who are exposed to medical waste are at a higher risk for things like not only infections, but infertility, cancer, dermatitis, neurological disorders, just to name a few. Here we look at 5 ways of treating medical waste. According to this chart, there are other ways to treat it other than incineration. So we're looking at autoclaving, or also known as thermal, irradiative, which is microwaving, chemical, and biological. So properly disposing of medical waste prevents infections and diseases from spreading, and it also helps our environment as well. Next, we look at the cost of medical waste management. It is a huge financial burden for institutions to have to manage and dispose medical waste. So we're looking at the cost of just managing it alone. That includes the personnel that they're using. If they don't have in-house personnel, they may have to contract individuals to manage the waste. that's a big financial burden in and of itself. And then we're also looking at the cost of disposal, depending on what type of ways they're getting rid of it, whether it's incineration or like the thermal or the biological. So these are all treatment of hazardous waste that need to be done. We also look at carting the waste and disposal into, unfortunately, what ends up in landfills. We also look at the cost of containers because you need special containers for specific types of waste. So that cost could be exponential depending on the color and the volume of those products that need to be waste. But it's extremely important to maintain proper segregation of waste because all of this is being regulated by the government, and this is how we determine where these products will go safely without causing harm to the environment. There are several different ways that we can look at managing medical waste or reducing medical waste, and this will ultimately lead to a better overall impact on our environment. So first we look at reducing the use of unnecessary supplies through better supply management. A lot of organizations are starting to adopt Lean Six Sigma rules for waste management. This helps reduce waste volume. Lean Six Sigma has 5 key pillars for reducing waste, and they look at first defining the problem, then they measure the current process, they analyze the cause of the issue, they look at improvements to the process, and then ways to move forward to control the issue. Raising awareness by educating individuals, whether it's in healthcare environments or individuals out in the community, can be one of the biggest impacts on managing medical waste. If individuals are aware of the issue and how to help control it, then they'll be more apt to ultimately help with the end result, which is improving the impact, the negative effects of medical waste on the environment. Environmental service workers actually could be a great asset in helping identify areas in institutions where there might be improper waste segregation and also unnecessary waste that's occurring every day. By encouraging leadership and stakeholders in healthcare environments, we can look to improving medical waste management, proper disposal, and ultimately more return on their investment or more money in their pocket. When they see the dollar signs, usually that helps motivate change. Color coding, labeling, and signage will also help to inform the staff of better ways of managing and also the proper disposal of medical waste to help minimize that. Also looking for leak-proof containers because this will ultimately lead to minimizing potential human exposure when it's being transported or when it's being disposed of, and also lead to a decrease in environmental exposure. Looking at ways to reduce the use of incinerators by alternative methods such as microwaving, autoclaving, which ultimately reducing the incinerators will lead to fewer hazardous materials being emitted into the environment. And lastly, looking at limiting single-use items, try to compare the prices overall, whether it's more beneficial to use a multi-use item if it's available. This will also help minimize the waste volume. COVID-19, like I said, has posed a huge threat on our environment just because of the volume of single-use items. So we really need to reevaluate that and look at also reducing plastic bags and things like that, because ultimately it's going to be an ongoing problem for an unknown amount of time. How can we advocate for change? Well, like I said, having a voice and being able to understand the problem and how we can start moving towards change is the first step. But there's also plenty of organizations out there that are available at your disposal, so you can get information and also find who to get in contact with if you are interested in advocating for these changes. So we're looking at the United States Environmental Protection Agency. The CDC often has a lot of good information about the effects of these products and waste on our environment. Also, the Agency for Toxic Disease and Substance Registry has a lot of really great information about toxins and things that are emitted into the environment when you have certain products that could hit landfills or are not disposed of properly. The World Health Organization has an endless amount of information, reports, and really great articles that you can read up about the latest information and research that's been done. UNICEF is really good about global perspective and seeing how other countries stack up to each other, and maybe even areas where you might want to advocate for other countries that are, third world countries that may be having trouble as well. National Waste and Recycling Association is another great organization that looks at how recycling products and waste products are being taken care of and managed. And also BioClean just happens to be a commercial organization, has some really great information on it about consumer advocacy. Thank you so much for listening to my presentation. Here's a list of references for the presentation, and I appreciate you taking the time to listen and learn more about how we can work together to improve medical waste management and decrease its effects on our environment.